And so how cool would that be to have a center where somebody comes up and not only the first day they come in, they get assessed, and if they qualify for the amniotic stem cell, they have the amniotic stem cell going to work right away.
Yeah.
And at the same time, too, they get hooked up with this neurostimulator to help reduce. So as you reprogram with your staff and you reset their mind and you reintroduce all these new lifestyles to them, they're more focused because they're not going, I'm sitting here thinking about my back. Because obviously your brain can only focus on so many things. If it's like your mother, constantly thinking about an issue, she's not absorbing some of the other information that's going around her. And so if you take that component out of it, and they're instantly like, wow, I feel better. I can pay attention to what this group is talking about. That'd be pretty amazing, wouldn't it?
Really huge. Absolutely.
Yeah. And the cool thing about that, too, it's covered by insurance.
It is covered by insurance.
Yeah.
That's incredible.
So, yeah. And Medicare is the best ones that cover it, too. So your older population.
Well, Mom will be coming down and seeing you, Doc.
Absolutely.
That's cool.
Yeah.
And so you're doing that in tandem. Is that happening now?
So we're going to be the first ones in Idaho. Starts September 9th.
So that's right away.
Yeah.
That's exciting, man.
Yeah.
And so let me ask you this, like with and what did you call it? Is it electro?
It's basically a neurotransmitter, or a neurostimulator, my bad, neurostimulator.
Okay.
And it has two parts to it. It has like a suction cup, goes behind the ear. And then there's 3 leads that go different parts of your ear, depending on what your situation is.
Fantastic.
Yeah.
And that's coming from, like you said, like an Eastern medicine type of an acupuncture type.
Well, it's both. It's coming from Eastern philosophy of auricular therapy, combined with neurostimulation from Western medicine. So it's kind of cool. So it's like acupuncture on steroids.
I love it.
Yeah.
Like bionic acupuncture.
Totally. Yeah.
And that's so one of the things that I know, and from like the recovery movement, and it's not just the recovery movement. Just watch the news. Is like the addiction in this country. People are not dying from smoking too much marijuana. They're dying from OxyContin. They're dying from the pain medications that are available and overprescribed for pain for people. And so I think what you're doing is going to be just got a huge market.
Absolutely. Absolutely.
Are you seeing that right now? Is that one of the reasons that you moved into that space, or is it just because it's more congruent with the stem cell therapies that you all are doing? Which, by the way, I'd like to hear more about
Absolutely.
how you started that, because I've researched that and heard just rave reviews from everybody who's ever had it done.
Yeah.
And when you mentioned to me that you were actually doing it now as like the primary, it was exciting to hear that it was now in Idaho.
Yes.
Can you kind of describe what that does?
So let's start with stem cell. So let's start and let's go through the little Reader's Digest version of it. It's too bad you couldn't be in our class last night because we did a seminar.
I'm sorry I wasn't able to make it. He was in town. And
Yeah, no worries. But so I was the very first patient that I know of in the Treasure Valley to have amniotic stem cell done. And so sitting right here on this table, had both my knees done. And to give you a background of where my knees were so bad before that since 3rd grade I had to, if I sat in a chair for more than a few minutes and bend my knees past 90 degrees, they'd dislocate. And so since 3rd grade, so as a 3rd grade kid, I had to sit in a chair because I couldn't sit on the floor doing crisscross applesauce like the other kids because they would dislocate. Wow. And then, you just learn to live with that kind of stuff. You grow up, you still try to do the same things, but sitting on your heels, my knees would pop up. And so I had bad knees, obviously. Dumb things I did when I was a little kid. Then I got involved in, as you know, the Hapkido and the Muay Thai, and I taught Muay Thai for 12 years. And so, when some 250-pound guy kind of, tries to break your knee, it's bad for your knees, apparently. Who would have thought? But fun stuff. So that didn't help my knees. And so I would drive an hour, get out the car, snap, crackle, pop, my knees, deep boring pain throughout my legs, going up and down stairs, ladders, all that stuff. Severe stabbing pain in my knees every day. That's just what I did. And you just deal with it. You go to, the wife says, hey, let's take the kids for a hike. Oh, got to go for a hike with the kids. It's a pain point to go and do those things. So 4 months, we'll be on the 20th. 4 months ago, had amniotic stem cell done on my knees. And amniotic stem cell has completely changed my life and a lot of my patients' lives too, where they are no longer thinking about that curb, thinking about that hike, thinking about, I need to grab that off the shelf. Which arm do I use because my shoulder's blown out? And the results are absolutely amazing. We're talking people that we have a patient who got told, you need to have a full knee replacement. And you first have to lose 70 pounds before you get that total knee replacement. Well, if your knees hurt, how are you going to be burning calories and doing stuff? She's stuck. And she's stuck in that mode, and what happens? Depression, drugs, oxys, all that stuff, because you're hurting and you have no out. And so it's affecting not only her family, she's barking at her husband, her kids, she's stuck. So she comes in, gets amniotic stem cell done. She went from 8s and 9s out of 10 for pain, down to 0s and 1s.
Just 0s and 1s.
Yeah, we saved her knee. And she was so excited, she did the other knee. Now she's I talked to her last week, and she's riding her quad and stuff like this with her kids and her grandkids and stuff. Like, that's so cool, right? And so it completely changed her life. We've done shoulders and ankles and wrists and lots of knees. We've done necks. We had a gentleman, he went from taking 3 to 4, speaking of medications, taking 3 to 4 days a week, taking a Norco, Tylenol, something, ibuprofen for his headaches. Came out of surgery 9 years ago, massive headaches. Never had headaches before. Had a fusion done in his neck. His hands were falling asleep, not working on him. So now he has all his medications and all these headaches. So we did amniotic stem cell through his neck, through his muscles. He went from taking 3 or 4 a week down to 3 or 4 a month. So for him, it's a huge success.
Success.
He's back into crawling with cars. He likes to work on. He's actually a nuclear physicist for St. Al's, so he's a smart guy. And now he can do all this little hobby of fixing up cars that he loves to do. And so, anyways, lots of success with this kind of stuff. But there's 3 areas of stem cell that I teach about, and why amniotics is the best. So if we back up, we got to think about how the body heals. So how does the body heal? The body needs 2 major things. It needs stem cell, which is like the foreman of the crew. It is what orchestrates everything, puts everything together to work. But then you need to have some building material. This foreman can say, let's build that wall, but you need some material. So you need some 2x4s, you need gravel and whatever to build that wall. And that's called growth factor. Okay, so as you age, you start to lose both of those. And so by the time you go from being young, when you're born, you have 1 stem cell for every 10,000. But as you age, as you get to about 60, you have 1 stem cell for every 1 million. So your ability to heal goes to the floor. Growth factor follows that curve. And those are the stories of, grandma rolled her ankle, blew out her ankle. She never quite healed. She never could get back. So what did they do? They took it off. True story. I have a patient that happened to. Okay, this grandma can't heal. That's why. Low in her stem cell and low in her growth factor. So what amniotic stem cell does, has the highest density of live viable stem cells to regrow tissue. So the foreman is there ready to go to work. Has the highest density of growth factor, which is the building blocks to build that tissue. So when you have a stem cell go to work, you have a stem cell that says, hey, this tissue is damaged, let's build this tissue. And so we need some growth factor, we need some stuff to do it. So as it takes this information and it says, okay, we're going to pull these growth factors in and we're going to rebuild cartilage, ligament, tendon, neural tissue, cardiac tissue. It will recreate damaged tissue. That's amazing. There's nothing in North America that is considered regenerative other than stem cell. Everything else is degenerative. It takes away. We take a Tylenol, got to get rid of the headache, but it's beating up our liver, beating up our kidneys. This stuff actually regenerates those tissues.
It's beyond amazing. It's
Absolutely.
been like a controversial, procedure for a lot of years. I know it's becoming more and more mainstream. One of the things that I learned through like pain management, a lot of these individuals they're on the OxyContin, they're on the Norcos for whatever it may be, like the athletes, people like my mother who's got the titanium rods in her back for scoliosis, taking 15 different pharmaceuticals. Yeah. Well, one of the challenges, like when you mask pain, is the byproduct of that is you're also masking your ability to empathize and have empathy with other human beings. And so we're creating this epidemic, or allopathic medicine is creating this epidemic of individuals who are taking care of their pain, but they're also cutting off their ability to be empathic toward the people that they love the most. That is the unintended consequence, or possibly even intended consequence. So you're not feeling any pain, but you're not feeling anything, and you're certainly not feeling the people around you.
Yes.
Challenging. What does that look like for a person's relationships? On top of the pain, to no longer have empathy for another human being. What's that doing to folks in families?
Yes. Well, even before that, even before you start that conversation, you have to look at the controversy around stem cell. There's no controversy anymore on stem cell. It's misunderstood There's 3 sources of stem cell that we know of right now. We have adult stem cell that comes from our cells. Okay, we can harvest it primarily from fat or adipose or bone marrow. Okay, our second one is embryological. That's where the controversy originally started. That's where the bulk of research started the industry. And so that is obviously illegal in the United States, and for obviously good reasons. The other one is the amniotic, which comes from the placenta. And so that's a whole entire conversation there. But placenta stem cell can create so much more healing because it has those factors. It has the stem cell and also has the growth factor. If I was to take your mother and say, okay, she needs stem cell, how old's your mother?
70.
70. So you have a person on earth here who's been hanging out for 70 years. She's kind of running on some used parts.
Yeah.
So now her stem cell's used, her growth factor's low. So now we go in there, we take that stem cell from her fat or maybe from her bone marrow. Okay. We have trauma, we have incision, we have chop, 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 pulling out fat, spinning it. Somebody's sitting there pulling off stem cells as much as they can. When they pull off that stem cell, even if they get some, it's very low in quantity, but the quality is very poor as well. That stem cell only changes into 2 different tissues. So if you have something that you need to heal a tissue and you don't have the right form for the job, the right stem cell, you still have the problem. So better, we'll go to bone marrow. So now they take this big needle and jab in your pelvis and they go scrape, 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 and they suck that stuff out. Now you have a second incision site, a lot of pain. They take that, they spin it, pull off that stem cell. Now that stem cell can differentiate or change into 4 different tissues. But yet you still lack the growth factor. And so your mother doesn't have much growth factor left. So she's missing half the puzzle. So now, if you go to amniotic stem cell, you're back into that 1 stem cell for every 10,000. So your mother's 70. So if we do the math on this, she's about 1 stem cell for every about 1.5 million.
Wow.
So she has 1 stem cell that has to babysit 1.5 million cells. So by the time that goes through all the way, that has to circle back around, she heals very, very slow. So now, if you throw in a bunch of viable, healthy living stem cell that can self-perpetuate and grow, now, and also you have the growth factors in there. She heals like she did back in the day.
That's awesome.
Which is really awesome. And there's a lot of research that shows, especially in joints, because in a joint you can see here's what it looked before, look what it did after 8 weeks, after 10 weeks. See that difference in joint. We have visual confirmation it's actually doing something. But here's what's exciting. Here's something your mother needs. Is there something called a wellness infusion, where it's not just about joints, it's not just about muscle. You can take that and you can do it through an IV.
Nice.
It's done over 10 minutes, and we add millions of stem cells into the whole entire person's being. So it goes ahead and it plays on the numbers. Now, does it cure disease? Increasing stem cell cures problems. We don't know where the stem cell is going to go by doing it intravenously. We have a patient. He's had 4 knee surgeries on his right knee, 3 on his left. He has diabetes. He also has an issue with his heart. He says, I can live with my pain. It's his diabetes that really bothers him. It hurts his soul that he has diabetes. He wants that fixed. And so we did a systemic push on him saying, we don't know where it's going to go. It's going to go to the site of inflammation and go to work there. Well, he wants his diabetes gone. So about 4 weeks into the injection, he reports that his knees feel fantastic. How's his diabetes? We don't know. But we know that his overall function, his overall being has been elevated.
Absolutely.
That is amazing. So what is that doing, back to your original comment? What does that do for relationships? What does that do for that person talking to their son, their grandkids? It completely changes. Their focus comes back into focus because they do not have as much pain. Because it's so much more than pain. There's a lady that had amniotic stem cell done down in Florida. She walks in, she has 20 to 30 years of knee pain and back pain. She gets an amniotic stem cell done. Within 4 weeks, nothing, no pain. Here's the cool thing, she's 91 years old.
Oh, wow.
91. So now what is she out there doing? Because it's more than pain. Now she's taking her little great-grandchildren. Let's go for a walk, let's go to the park. She's working on her BMI. She's stimulating her brain through moving her body. So now, engaging in life.
Yeah.
Would that not exist? Oh, it's just about pain. No, it's not. There's a trickle-down effect that affects so many aspects of someone's being, and that's pretty amazing.
Ed, I think it's so exciting. I've got a good friend that I went to high school with, well, just a a really great friend, and we don't get to hang out because he had back surgeries. And there was actually some problems within the back surgery itself.
Absolutely, yeah.
Which compounds the fact that it's like, man, I didn't have this many issues prior to the back surgery, and now he's a statistic. He's on multiple, pharmaceuticals for pain, and I'll call him and just say, hey, look, I'm going to be passing through over the weekend. What do you think? So, dude, I'm not doing well, because it's like he's not coherent. He's not able to interact and engage, and the byproduct of that is he's gained a tremendous amount of weight, and it's sad. I mean, to hear people that that I know and love talk about suicide. I've never heard more than from pain. It's a chronic pain is horrible.
Well, here's one of the most exciting things we're getting to as well, is that we are getting into auricular therapy with the combination of Western philosophies of acupuncture and with the benefits of North American technology. And so we're going to be the very first people in this area to be able to combine the two and offer a therapy based on Oriental medicine and the Western medicine combining, that's going to be able to drastically reduce people's pains and syndromes. And again, building back their life. It's a unit that sits on the back side of your ear, and it stimulates acupuncture points to increase their body's endorphins. So you can learn how to overcome a pain naturally without drugs or any type of surgeries or anything. Their body resets, and they learn how to use their endorphins and their enkephalins their body produces, which is your natural pain suppressants, to be able to reduce those stories.
Love it.
And it's amazing. It has an amazing track record.
Well, on that note, I know that there is an Asian acupuncturist who's moved into the States, and I'm sure there's a lot. But this particular individual, folks who did not want to go under any type of anesthesia or pain medication during surgery, he was that one guy that would go to. Now, this is specifically for surgery. And we're talking cutting them open, going in, and like even knee replacement stuff.
Yeah.
And purely through acupuncture, the pain was suppressed enough for them to do an actual surgery. And so to hear that what you're talking about for individuals who, just for that, if they can do that for a surgery,
right.
Can you imagine what you're talking about for people with just chronic pain? It's fabulous.
And what's neat about this whole entire thing is that everybody can get this. You don't have to have a world-renowned acupuncturist. Cool. You can have the apparatuses, the Western technology that allows more and more people to have access to those type of treatments.
That's cool.
And the amazing thing is insurance covers it. And so that's a nice marriage between the Eastern philosophy and the Western philosophy. It's going to help a lot of people.
So Ed, can you kind of describe what it would take for someone like, say, my mother, if she wants to, and I'm sure she's going to, want to have stem cell therapy? What are the time frames? What does the procedure look like?
Right.
And what can she expect?
So we are absolutely, and you are too, we understand how information is so important. If we all sit here and we go, oh, I wish I knew that 20 years ago. Right. And so we want to make sure that people understand and they're educated about everything that they're getting themselves into. And so what we do with every single patient, we have a consultation. We sit down and see if they qualify, not only just through a history, but also they meet with medical staff to go through a physical to find out if there's any contraindications of why they could not have the amniotic stem cell done. At that point, if it's determined by the medical staff that yes, amniotic stem cell could help you and could be a benefit, then what we do is we go ahead and we set a date, and then that date comes around, and it's actually a very simple procedure. Now, depending on what the condition is, depends on how long it takes. If it's somebody's coming in because they have worn out knees or an ankle or a shoulder or a hip, that procedure is relatively fast. But before that, we send them for x-rays. We have an x-ray facility that takes the proper x-rays to determine level of degeneration, level of damage in the tissue. And then from that point, it determines whether they're going to need how much volume of amniotic stem cell. When that's determined, they come in, they have the injection done. But at that point, we do something that's very different. We want to make sure, again, knowledge is power and the utilization of that knowledge. And so we want to make sure they understand how they got there in the first place. Even if they got there by being hit by a car, if you took that same person and their twin, and one person ate a bunch of fast food and Twinkies and a bunch of pro-inflammatory foods, they're going to react differently So we want to make sure that they understand that the car accident did not always cause the condition. It's the failure to heal correctly that causes most of our issues.
Got it.
And so this helps to heal those conditions because your body can heal more correctly. But we want to go a little bit further. So we have them come back in, and depending on whether an issue is, 1 or 2 weeks later, and they start a very small, short rehabilitative process, which is them mostly to understand how that whole thing started. How did I get degeneration in that joint? How did it happen? And when you understand that, then you have more proactive approach of, hey, how can I stop this from ever happening again? Because so many people wake up, even if they didn't have a trauma, and they sit there and, yeah, I got my right knee has no cartilage left in it. It's because I did all that running. Well, doesn't it take 2 knees to run? So why did the one just go on you? And so things need to be addressed so people get taught how to do things. And we functionally, we want to make sure people understand their low-tech rehab so they can take that, understand it, and put it into their life at home.
I love it. It's fantastic.
Yep.
I've got, I want to shift gears on you. So when you and I first met, years ago now.
Yeah, it's crazy, huh?
Been awesome. No, yeah, it's crazy how fast it goes.
Not fair.
And I met you at a time when I was like reinventing myself. You know, it was when the economy fell apart back in 2007, 8, 9. And in 2009 is when I really took it serious that I noticed I couldn't, when I went to the gym, all that happened was I got sore. I was actually like breaking down and I wasn't rebuilding. I was having a hard time gaining weight. Like muscle mass. I could gain weight, but not muscle mass. And I had this like, kind of a low-grade depression all the time. And it was from construction. It was from the construction, the food that I ate while I worked, although I was pretty mindful of it. You still, once a day, I was through a fast food joint back then. And it was the stress of the economy falling apart and having my family, you know, taking care of my family, that I went on that search for, okay, if now this didn't work. The previous 35 years of my life and what I was told to do, this is what it's resulted in. Might not be that way for everybody, but I'm going to do it differently. But I also want to have that vibrancy and that youth, because my children, which by the way, through all that stuff I'd missed so much time with, I want to spend time with them. So I started putting my diet together. I started putting the lifting together, got my hormones taken care of and optimized. A big game changer. And when I came and saw you, I had, remember the calf issue?
Yep.
From, I was running, I wanted to run. Running was one of the greatest antidepressants for me ever. But at a certain point, I was in chronic pain. And I came in and you did some work on that muscle, and you showed me something that it doesn't take a doctor visit. It just takes some discipline to do, which was foam rolling.
Yeah. And
foam rolling has been one of the biggest game changers for me since I met you. That first of all, I couldn't stand you. It's like, oh damn you, Ed Riggs! I would foam roll. It was so painful, and there's a reason for that. I'd love for you to describe, how important foam rolling is, what it is, why it's important, and what it can do for folks. Because since I've been doing that, my mobility has gone through. It's not just maintained, but increased. I've been able to do more of the things that I wanted to do 10 years ago, but wasn't able to do.
Right. So foam rolling is something that's really caught on in a lot of different sports, and it's finally nice to see because true proper foam rolling helps not only reduce certain pains but increases function, and the increasing of function is where it's at. And without getting too technical behind all the terms of what foam rolling does, basically in a nutshell, foam roll allows the muscle and the contents, the fascia that holds the muscle together, to become more pliable, more flexible, therefore decreasing dysfunction inside that muscle. And so foam rolling is one of the most beautiful ways, and I preach this to all my patients because I'm not here to adopt patients. I want patients to be empowered to know how to take care of themselves. As you know, that's one of my things.
Responsibility.
And that's huge.
Yeah.
And so and here's the amazing thing about foam rolling, especially for the lower extremities, is you can take care of probably about 80% of these issues by yourself if you know how to do it properly. And when a lot of people go online, they see lots of stuff out there. And there's some of it's good, some of it's not so good. But when you understand the premise of the physiology and the actual foam rolling, how they work together, again, you can take care of 80% of that stuff all by yourself.
So cool.
And so it helps with tracking issues, helps with calf pulls, hamstring, low back issues, helps with so much. And so it's a way of doing myofascial release and making the muscles just overall healthier.
It's so powerful. And what did you say the percentage of fascia in our body is like incredible? It's a high percentage of our...
Yeah, actually fascia, our connective tissue, makes up 20% of our body weight. And so and you think about that for a second, 20%. A lot of people don't know that fascia makes up 20% of our body. So with fascia makes up 20% of our body weight, and so what a lot of people don't know is that, right there's great.
Right there's great.
So fascia makes up 20% of our body weight, but what a lot of people don't really make that connection on is the fact that if you never heard of fascia before, you've not functioned or you've not understood 20% of your whole entire being. That's a lot when you put it in that percent.
Fascia. We're not talking about what fascia is.
Yeah, we're not talking about some roof construction stuff. We're talking about the connective tissue that holds us together and gives our body our shape. Fascia is stuff that holds our muscles in, the actual contractile proteins, holds them in place. It gives us a shape to our muscles, therefore the function of our muscles, and teaches them how to contract, or is responsible for their function and how to contract, holds our skin down, holds our organs in place. And if we took all the fascia away from you, I'd still be able to say, I know who that is. Because that's how intertwined fascia is in our whole entire being.
Really?
Yeah. And so fascia also, it's impossible to contract one muscle at a time. And so when you hear about these stories of mom bends over, grabs the car, lifts it off her kid, fascia is responsible for that spreading out those pounds per square inch, spreading out that force and being able to contract so many muscles to contract and to lift such a huge weight. Because as you know, no single muscle could ever do that.
Right.
We could not do it, but fascia transmits that force so somebody can have such great strength.
It's powerful.
Yeah.
One thing I want to ask you about, and if you can validate this, is a lot of people that I work with, we work on stress reduction almost out of the gates.
Right.
Like breathing, stress reduction, getting more sleep and rest. And part of that stress reduction is to release that on a cellular level, because I know that there's a memory, at a cellular level from trauma. And I found that foam rolling, through the process of working directly with a client and through trauma release, has been hugely beneficial. Have you noticed that, or have you got anything any testimonials you can share on that?
Well, absolutely. There is a huge relationship between how our body takes in damage and how we store it. We've all been through that episode of a certain song, and we have that memory of this, or we smell something and it brings us back to a memory of a certain time of our life, our grandma's house or mom's house, or those cookies mean this. And so just like we pattern ourselves with smells and with sound, we also do that thing with trauma as well. And so we can think about that car accident, and I've had just recently a lady who went through a second really bad head-on collision, and now she is so scared to even drive. She cannot drive herself because she went through that trauma, and now her body is in response to that. And so what happens with our bodies and how we store those memories is that they don't fully understand all the mechanisms behind it, but just as if, and we all can understand this, we've all gone to the drive-thru, like you were talking about earlier, one too many times, and we can realize that what we put in here makes us feel a certain way here. Just like we can worry ourselves sick to the point of vomiting. So the connection between our brain and our body is so strong. And we typically go from brain to body. But at the same time, too, we've had pain signals from our body tell our brain something to the point of, I hurt so bad I threw up, in your classic migraine. So that combination goes both directions. And what you're talking about with the foam rolling and just overall taking care of your physical side is a tangible thing to maybe to start with, but it will always affect the mind. And so it all depends on how we pattern ourselves into that. And so the body does have remembrance. We've all heard of muscle memory. We've heard about these different videos that come out that talk about muscle confusion. There's a certain remembrance in muscles. How many people walk around with stress and they go whoop, and their shoulders come up because of stress, and they don't realize they're doing it. And what does that do to muscular tissue? It causes more damage. So that cycle can just perpetuate and continue to go and go and go.
I love the work you do. And it was only by chance, I believe, that you and I even met. I don't know if it was through chat or somehow we met.
Yeah,
What do you see with the work that you do? Like, if you could put it into, the joy that it brings you, what do you see for folks?
Truly, I see in this region of the world, there is no place that I know of that can take care of all the physiological things which ultimately determined higher things. And so there's not one place, and we're trying to create a center for people to go to that have the opportunity to do everything natural, everything related from diet to massage therapy to chiropractic to myofascial release that's very specific, all the way up to medical side of things that are alternative to regrow our tissues. And we do everything minus surgeries and casting. And so if people are able to understand and be educated on how to take care of this space, then it's one less thing that they'll have to worry about. And truly, pain changes, and it changes individuals. And so if you have an outlet, you have a place to go to understand and be educated, to take care of yourself, where you become, so you're not dependent upon other doctors, myself, other people, you truly get control. And it's a start, so you can start to work on other things. And what really gets me excited is when you work with somebody and you work with these people who have had chronic pain for 20, 30, 40, 60 years, and that goes away. I've had people walk up to me and go, I've had pain for 50 years. It's gone. Now what do I do? And they're lost. But it's a good thing to be lost.
Their old friend is gone.
They're old, yes. And now they have a new slate of life, and they're almost lost. And you tell these people, you pick up your grandchildren, you love on them, you talk nicer to your spouse, you develop those relationships in your life that give you joy. And that is so much more than pain.
Brother, what you're doing, I mean, versus the OxyContin and the Norcos that take away the pain but also take away the empathy, you're giving back people a life. You're giving them a life worth living. It's super awesome. Come here, big guy. Give me a hug. Ricky, man. All right.
It's good to see you again.
Good job. Good stuff.